Jamie, what's causing these circulatory and diabetes problems that the government fears is partly to blame for these excess deaths?
Yeah, evening, Dan. I think it's probably worth just starting with what excess deaths are. And what you do is you can look at current deaths that are circulating across the country, which the ONS publish every single week, and then compare them to kind of the trends each week that you saw pre-pandemic. And 2022 has been a tale of two halves, actually. We saw deaths below average up to about week 15 of the year. And that's not surprising, Dan, because we've seen a lot of excess deaths through 2020 and 2021. And you can't die twice. So people who perhaps would have died now may have sadly died earlier on in the pandemic. But since week 15, we have been seeing this big rise in excess deaths across the country, at least 10% above average. Now, you've talked a little bit about what the Department of Health has cited for some of these different things. One of the things I'll probably point out is that the excess deaths are among a range of different age groups, because I think about a quarter of the excess deaths we've seen at the moment, Dan, at least a quarter, is because the population's aging. We've got more older people in the population than we had 2015 to 2019. But that doesn't explain all of it. There's still at least three quarters that need explaining. Now, we've got excess deaths above average, over 10% now in the age groups 10 to 14, 30 to 34, 35 to 39, 55 to 59, 60 to 64, and 70 to 75. And I think there's probably a bit of everything that you've mentioned there. We've got missed healthcare is bound to be a factor. We know back in May when they talked about
the
these
lockdown impact.
Yeah, the lockdowns and the diabetes checks. And what happened there was, Dan, there was fewer checks being done with diabetes patients. Yes. And it was NHS England's own analysis. This isn't some academics. It was NHS England's own analysis that cited these excess deaths. And we've kind of got record A&E attendances at the moment, Dan.
Totally.
We've seen this vicious circle of things going on, and we're seeing these excess deaths everywhere.
And Jamie, I understand all of that. And I also understand that the heat would have contributed a certain number of excess deaths as well. I get all of that. But, Jamie, is the elephant in the room here that we're not talking about enough potential deadly side effects from the COVID vaccine?
Well, I think there's a lot of people who will cite that, but I think there's going to be an element, there's probably going to be some of that, because obviously we do know now that some people have sadly died after taking the vaccine. The government are starting to issue compensation themselves. So obviously, if there wasn't a mass vaccine rollout, they would be kind of alive and not in the statistics in terms of deaths. So we do know that there's definitely going to be an element of the large number of missed healthcare. I think you've got tomorrow Professor Carol Sikora coming on talking about a lot of the misdiagnosis or delayed diagnosis of cancer patients. That's going to be a factor in there as well. And I think one thing that's not talked about a lot, Dan, is the fact that the health system, you've got a vicious storm here with people who can't get GP appointments. They turn up at A&E, they fill the A&E department, and we now know that for the latest figures, Dan, it's 13,000 patients in hospital who are ready to be discharged. Now, they can't be discharged because there's not enough care in the community. Now, they sacked all those care workers because they wouldn't have a COVID vaccine last year, which has meant that there's less care workers out there. Now, those 13,000 patients in hospital, if they were discharged, people in A&E would be admitted into the actual hospital. So you've got this vicious circle of ambulances queuing up outside because they can't admit people who can't leave hospital. And this is all government policy. It's failed us here, Dan.
And all of this was so predictable, and people like you were shouting about it for the past year.